Welcome to part 2 of 2 of English for Health for Postnatal Care. In this video, you'll learn about the different health services which can help keep you and your child healthy. Before we get started, let's look at some useful words. Pause each word to read the description. Immunisations, bottle feeding, pelvic floor. Okay, let's begin. If your child is ill, there are different NHS services you can use based on how ill they are. Some problems can be managed at home by following the advice of your GP or health visitor. For example, if your baby is teething, you can give them a teething ring, or once they are 4 months old, some sugar-free teething gel. For minor illnesses, you should use the pharmacist, also called a chemist. A pharmacist is able to give you free advice and sell some medicines for minor illnesses like a cough or a cold. Think Pharmacy First is a scheme that means if you get free prescriptions, you can also receive free non-prescription medicine for you and your children. NHS 111 can help you if you have an urgent medical problem and are not sure what to do. You can use your phone, or if your child is over 5, a computer to talk to an advisor. If your child is ill, you can make an appointment with your GP. An example of when to see your GP is if your child has a fever of 38 degrees or higher. Most GPs will try to see children within 24 hours, depending on the age of the child, so check with your own GP. To learn more about booking a GP appointment, watch video 3 of English for Health. For non-emergency illnesses, you can visit an urgent treatment centre, sometimes called a walk-in centre. They are open at least 12 hours every day and will treat children of all ages. You should take your child to an urgent treatment centre for things like minor cuts or burns. A&E stands for Accident and Emergency and is located inside hospitals. You should use A&E if your child has a serious condition or injury that needs immediate treatment but is not life-threatening. This includes problems such as broken bones. Some hospitals will have a separate A&E just for children, with specially trained staff for children's health. If your child is seriously ill and their life could be in danger, call 999. For example, if your child is struggling to breathe or breathing more than 60 breaths a minute. To learn more about child illnesses, follow the link on screen. Now we'll learn about vaccinations, sometimes also called immunisations. They protect your child and others from serious diseases such as pneumonia, meningitis, and sepsis. Vaccines are the most important thing we can do to protect our children, and they prevent up to 3 million deaths every year. Children under 12 months old are most at risk from infections, so it's important to get them vaccinated at the right time. The NHS has a vaccine schedule to keep children as protected as possible. This includes vaccines at 8, 12 and 16 weeks, 1 year and 3 years 4 months. You should receive a letter, email, text or phone call from your GP to book your child's vaccines. As a new mum, there are some health issues you may experience, so what should you look out for? Mastitis is pain in your breast and can happen even if you are not breastfeeding. Usually only one breast is affected, and symptoms include swelling or a lump that feels hot or painful to touch, a burning pain either constant or when breastfeeding, discharge from your nipple which may have streaks of blood, flu symptoms such as headaches or a high fever. If you think you have mastitis, contact your GP who may give you antibiotics. There are also breastfeeding drop-in sessions, cafes and centres where you can get support alongside other mums. No appointment is needed. To find out what's available in your area, you can ask your midwife, health visitor or GP. When you give birth, the muscles in your pelvic floor can stretch. This may cause you to leak wind, wee or even poo. Doing pelvic floor exercises after birth can help prevent this. You should contact your GP if you have any of these symptoms after your 6-week check. It's normal to bleed from the vagina after giving birth. You should avoid using tampons until after your 6-week check, as they may cause an infection. The bleeding may last for a few weeks and will turn brown before stopping. If you're losing blood in large clots 3 to 4 days after birth, contact your midwife for treatment. If the bleeding is heavier than expected or is not getting lighter, contact your GP or health visitor. Postnatal depression is a mental health condition that many parents have after having a baby. It is common and affects more than 1 in 10 women. There are many signs that you or someone you know might be depressed, including not bonding with your baby and having frightening thoughts of hurting them. Postnatal depression can have a significant impact on you, your baby, and your family, so it's important to seek help. You can speak to your midwife, health visitor, or GP. You can also contact one of the organisations on screen or search for local charities in your area. That's the end of Module 2 for postnatal health. Let's look at some questions and see how much you remember. Pause the video after each question and press play when you have an answer ready. If your child has a cough, which NHS service should you use? For a cough, you should use the pharmacy or chemist. When does your child have their first vaccination? The first vaccination is at 8 weeks.